And I would encourage every single person watching this video to, number one, do your research, and number two, try to heal yourself and get healthy before you get to the stage of having to take medicine. According to the CDC, non-Hispanic Black women had 63% higher risk of developing diabetes compared with non-Hispanic white women. According to the American Cancer Society, Black people are more likely to die from most cancers and live the shortest amount of time after cancer diagnosis than any other racial or ethnic group. More Black women die from breast cancer than any other group. And according to the American Heart Association, heart disease is the leading cause of death for African American women in the United States. And if you're in your 40s, 30s, and 20s, you might be at risk. Now, as I have read these statistics off to you from these different organizations, you might be thinking, one, nothing new here. You already know this. You've already heard it. Number two, what does this have to do with you? You're trying your best to live your life. You don't want to be bogged down with these numbers. Or number three, you don't trust these organizations and the information they spew out. And I understand. I get it. And as I came back from the annual Menopause Society meeting, of course, menopause was the discussion of the week. That was discussion of the entire meeting. However, the gaps in care for Black women specifically was called out several times during the meeting on topics such as obesity, heart disease, cancer, other metabolic diseases, on top of menopause, which made it more difficult to treat Black women in the healthcare setting. A lot of the healthcare providers that were at the meeting stressed the importance of annual physicals and eating well and sleeping well. But we as a community have to think about how we're implementing these things into our lives. And I think one of the number one things that we don't always address, which I spoke about on this video here, is our mental health. We don't always look first to the mental health to see how we're doing, because often if your mind is not right, you're not going to be able to implement some of the things that I want to talk about today. But because I'm specifically talking about implementing some things in our day-to-day lives to get us off that track, that path of heart disease and diabetes and obesity, I'm just going to encourage you to watch my previous video on mental health, and then let's just continue to talk about some of the things we can do so that we can, of course, get off this path of destruction in our communities. So the number one thing I want to talk to you about is addressing your sleeping patterns and your sleeping habits. Now, one of the things I picked up at the Menopause Society meeting is when women are addressing insomnia and sleep disturbances, which seems to creep up as we age, there are multiple ways we can help ourselves. But oftentimes we just focus on the sleep hygiene, warm or cool room, I should say, or putting away your phone 1 hour, 2 hours before sleeping. But there are certain things that we can do in addition to sleep hygiene, which is probably the number one thing people only try. But let's talk about sleep restriction and sleep control. Sleeping the same amount of time every day, every night. So if you're going to go to sleep between 11 p.m. and 7 a.m., you're going to have to stick with that time. Stick with that time no matter what you're doing, no matter what's going on. You're going to have to control the time in which you're sleeping so that you can get on a routine that's going to be beneficial for you. And 7 to 9 hours is the optimal time for you to get rest. I know that's rare for a lot of us. We'll be happy to get 7. But think about restriction and control of your sleep. Another thing I want you to think about is stimulus. Now, when stimulus, we talked about using your phone and having too much stimuli, but this also is related to television. It's also related to talking to people on the phone. It's also related to having things excite you too much before going to bed. You have to think about what it is that's going to heighten your stimuli before going to bed and eliminate that. If you know what are your triggers, then you have to cut those off. Also, we talked about cognitive therapy. If many of you are not in therapy or haven't tried therapy, you might need therapy. Easier said than done. If you have it through your work, it might be easier to go through your work if they're offering some free sessions, or I'll link a particular website that offers free therapy. I've linked this before, so I'm going to link it again. Hopefully you can use this to your benefit. And then also relaxation techniques might be beneficial for you. So meditation before sleeping, prayer before sleeping, not too much. Reading might relax you, but if you're reading a book that's going to keep you turning the page before you sleep, don't do that. Don't put that book down. So we're talking about sleep here and ways in which you need to improve your sleep, because sleep is a big issue for women. If you don't sleep well, you have poor performance at work, you have poor performance on your day-to-day lives, you might even have poor performance on your studies, your exams, in the gym. So all of these things add up. Now, the second thing that's going to be important for you is to evaluate how you're eating. The standard American diet, or the SAD diet, is laced with a lot of simple sugars, simple carbs, a lot of trans fat, a lot of processed food that it's easy for us to grab and go. And we may not understand the impact that it's having on our lives until it's a little bit too late, or how it's affecting our health until it's a little bit later. So what I would encourage many of you watching to do is to take it one step at a time and start tracking your food. Start tracking the food of those around you. You might have to eat differently from what other people are eating from you, and that's okay. One of the biggest issues is that we are not spending enough time understanding what works with us and how it is, if it's healthy for us, what the food we're eating, if it's healthy for us. And so it's going to take some time to adjust your eating habits and to figure out how to implement more fruits and vegetables, more whole grains, more protein, as well as more complex carbs like sweet potatoes and brown rice and quinoa, if that's what you prefer to eat. Eating is such a big deal, especially if you're on a weight loss or recomposition routine. It's 80% of getting us to longevity if you're thinking about the split between exercise and nutrition. So it's going to be really important. And that leads me on to the third point I want to make is the exercise. Now, ladies, I'm going to be sincere with you. You need to move. You need to get up and move and walk and run and jog and do whatever your knees, bones, feet, hands will allow you to do. If you're not careful about your bone health, your muscle health, your heart health, it can be quite cumbersome as you age to use all of your energy to take care of yourself. And that's why I always encourage you to walk, run, get moving, do something that's going to be beneficial for you, even if it's the smallest thing. I posted a leg workout video not that long ago, and it took a while before I could even get to that stage. And I'm not even where I want to be at this point. It's baby steps. Step by step, you get into the gym or you get into your home and you start doing things that are going to be beneficial for your health and your longevity. But the most important thing to do is to start moving. Now, the fourth thing I want you to consider is annual checkups. I know that there are things that might be preventing you from getting your annual checkup. You might have limited access to care, or you might live in an area where you're not able to see a practicing physician as often. But when you are able to, and if you are able to, and I will leave a link with some provider information below, I want you to really take it seriously when you're going in. If there's something bothering you, if there's something ailing you, talk about it. Also, do your research. I know a lot of you might be thinking, well, the doctor's just going to throw a pill at me. They're just going to give me a prescription for this medication, and I don't know how this medication is going to impact my life or make me feel. And those are all valid questions, to be sincere with you. I'm a pharmacist. I've worked in research and development. I know all about the drug development process, and I would encourage every single person watching this video to, number one, do your research, and number two, try to heal yourself and get healthy before you get to the stage of having to take medicine. I really encourage you to do that, because once you're on medicines, not all medications cure. They might treat the symptoms, but they don't cure the disease. And that's what you're going to have to really take into consideration with medication, with your health, with your diet, and with your exercise. It's going to be really important for you to do that. So when you go in for your annual checkups, be open. A lot of you might be thinking, okay, this physician doesn't care about me, this physician is glossing over what I'm trying to explain, what I'm trying to say. Prepare before you go in. Have a list of things you want to talk about. Have a list of maybe concerns that you want to talk through, get through. A lot of these physicians have 15 minutes. So if you do the talking first to try to get your questions answered, it'll be better for you. And I think that's one of the issues that a lot of women were having during the menopausal stage in life, is that they would go for their annual visits, their annual checkups, and many won't express what they're feeling in terms of genitourinary syndrome of menopause, or vasomotor symptoms, or other menopausal related symptoms that are more unusual than the common ones that we always hear. So it's going to be really important for us to make sure we are discussing these things at our checkups with our healthcare providers. So one of the things I want you to consider is always keeping a journal and keeping track of what you're eating, what you're doing, how you're moving, what's working, what's not working, where your frustrations are, and to try and be patient with yourself. As you get older, sometimes our metabolism slows down until we can get it into an area where it's picked up again. But just know that you can do it and you will do it. So I hope that the information in this particular video has been beneficial for you. I really do encourage all of you sisters to move. And then I also want to I have a lot of menopausal information that I want to share with you from the annual Menopause Society meeting. So if you have any questions, please leave them down in the comments below. And don't forget to sign up for my Pause and Prepare newsletter and pick up the free health guide on your way there. So I thank you for watching and see you in the next video. Take care. Bye.